Hello, I'm now going to take you through a short presentation detailing how to answer all of the questions for the Health and the People paper 2, this section of it. I'll make this fairly brief and concise, but I will put more detailed descriptions of how to answer these questions in the videos below. Okay, so let's get on with it. Some basic things, I won't spend long on this, but make sure you read the questions carefully and underline the key words. The command words at the beginning are always the same, but there's always a different focus, so look for that focus. Clearly, keeping a close eye on time is really, really important. Remember the how useful source question in this paper is the same set of skills as the how useful source question in paper 1. So that's, remember they're the same things they're looking for. Don't forget SPAG for question 4, that's really important. Reading through your work and answer. Always write something. Better to write something than nothing. That's what I always say. A blank space won't get you anything. Something that you write, even if it's a guess, might get you something, so always put something down. Okay, let's talk about question 1 then. The first 3 questions are all 8 marks, by the way, and that should take you about 10 minutes, give or take. You can have a little bit more, but not much. So I have a system for this that my students will know, hopefully, and it's scope. And this is what you need to do. Scope the source. Imagine it's like a sort of scope on a gun and you're really narrowing in on the, focusing in on what you should do for this. So you're going to get, it's highly likely to be a picture and very likely to be, it's often a satirical cartoon, but not always. It might be a poster, might be something else. And it'll ask you how useful the source is. So the first and really important thing is it'll ask you how useful the source is for an historian studying something. You want to underline what that thing is. In this case, you can see it's studying public health in the 19th century. So that is what you are focused on in this question. It is asking you, what is it telling you about public health? So to scope this source, I've done a little example. I haven't written a huge amount, but I'm trying to give you a sense of the kind of thing you might want to do for a source like this. So in this source, what's it telling us about public health? Well, it's telling us, if you look at that source, and I would definitely recommend pausing it and looking, that water from the Thames was making people ill. So in other words, public health was pretty bad in the early 19th century because of the water from the Thames. So you're going to pick up marks just from looking at the source and working that out. Then you're going to use your contextual knowledge to explain that. That's the C of scope. You might say things, for example, like diseases like cholera were rife in cities like London because of the Industrial Revolution, and because there were no sewers at the time. People crowded into these cities, and there were no, and in this case the Thames served as the means to get rid of people's waste, but it was also drinking water. So you're talking about those kind of things, and that led to several cholera outbreaks in the early and mid 19th century. You want to think about the origin and the purpose of this source. Those two things are together. So you've got to look at the provenance. You've got to look above the picture. What's it telling you about who made this, when they made it, why they made it? So I would say here you might want to pick out some things like this was made in 1832. And what's really interesting here, it was just after a major cholera outbreak in 1831. So it's given us, it's that point at which people are beginning to get very worried about this terrible disease. And we look at the title, which is "Let the Safety of the People Be the Supreme Law." We can sort of infer from that comment that this cartoonist is trying to demand change, and he's reflecting, or she's reflecting, must probably a man, I would imagine at this point, reflecting a certain amount of anger in the community, and that there was a desire for change. And so this is a really useful source for an historian, because it shows us that people were beginning to challenge the status quo and they were beginning to demand improvements in health. So there's an idea of the kind of thing I would do. So let's have a look at the second question. Another 8 marker, 10 more minutes. This will always ask you to consider the significance of a person, or in this case actually people, an event, or a sort of development in medicine. Okay, now you need to try to write about 2 ways, if you can, about why this, in this case, it's two people, why they were significant. Now, the best answers are also able at the end to be able to show maybe if you've talked about two ways that are significant, how those things were connected, or maybe a good way to think about it is thinking about how that significance changes over time. Okay, that's a really good way to think about this. Now, remember, thinking about that, and this is a really good example, it could be that something is significant at one period but not at another. So in this case, Hippocrates and Galen clearly very significant during the medieval era, but that significance declined throughout the Renaissance, and that would be a good conclusion. But you might want to talk, for example, about the significance of the four humours theory and how significant that was and why it was significant. You might want to consider the significance of balancing those four humours and the necessity to purge, for example. And you might want to talk about those and then talk about how that significance declined over time. So the third question is going to ask you to compare either people or events or developments, which you can see here it's developments because it's about surgery and anatomy, in two different time periods. Now, the crucial thing here will be there are four time periods. So there's the first bit, which is all about medicine standing still in the medieval era. There's the second bit, which is Renaissance, when there's the beginning and into the kind of early modern and Georgian period up to about 1800, late 1400s to about 1800, where you get the beginnings of change. And then the third section is the 19th century, where you get a lot of change, and then modern medicine, where there's a profound, huge amount of change. So that's 20th and 21st century. Now, you're going to be asked to compare across two time periods, and you're going to be asked for either similarities or differences. So again, underlining what are the time periods, what are they looking for, similar or difference. That's really, really important, so you've got that in your mind. And you're trying to write about two similarities or differences. Now, in the one example on the board there, it kind of falls out relatively nicely because you can talk about surgery, similarities between 19th and Renaissance, and you can talk about anatomy, dissection, for example, being used in both 19th century and the Renaissance as a means for students to understand more about the human body. Now, for some of them, it might be slightly trickier, and you might want to think about the notion of causes, events, and consequences. So if it's a kind of an event, you might think about what do people believe about that event? What is, for example, if it's comparing the plague of 1348 and the plagues of 1665, it could be it might be you say about what people believe were the causes of the plague. The example. There's another example on the screen there, which is comparing people, Pasteur and Fleming. So again, in this case, you might want to consider the consequences of their work. Both had profound consequences that were life-changing. So, for example, with Louis Pasteur, his work led to the development of vaccines, which saved many millions of lives, and for Alexander Fleming, his work on penicillin helped lead to save many millions of lives as well. And obviously, they both relate there, don't they, to fighting infections as well. So that might be a way to think about that. Again, trying to do, if you can, two similarities or differences. Okay. And then some judgment as how far were they similar as well. Okay. Next. So this is the last question, but you may wish to answer it first because it's one of those ones that, as I've put here, you can really prepare for in advance. It's worth 16 marks plus 4 marks for spelling and grammar, so you should be spending 20 minutes on it. But it's one you can plan for. What's it asking you? It's asking you how a particular factor has influenced the development of a particular aspect of medicine over time. Now, it's worth bearing a few little things in mind here because it's easy to get caught out. So one of the things you really want to bear in mind is look at the date at the bottom, because it will say use a range of examples from across your study circa 1000 to the present day. Now, usually, in my experience, it's the whole course you can use examples from. Sometimes it might not be. So look at that date, underline it. The other thing that's really important is you've got to talk about the factor in the statement. So in this case, if you look at it, it's about the role of the individual. So you have to talk about individuals in this answer, but you really want to talk about at least one other factor, and ideally maybe 2 or 3 more. So, you know, but do talk about the one that is in there. That's really, really important. Now, the best answers, because this is an essay question, will reach some sort of judgment saying which was the most important, or arguing why perhaps of the factors some are more important than others, or how they connect, some sort of judgment. But most of the mark will lie in talking about those factors and how they've influenced something. Now, look, you can see there, I've done a little arrow. Look at that, look at the factor and underline it, because you must talk about that one. So look at the date from when you got it, you can talk about, is it the whole course or part? Look at the factor, and that's another really important thing. Now, the other thing to really bear in mind in this one is, as you can see my little arrow there, is it usually will ask you about a particular area of the course. So it won't usually say, for example, has the role of the individual been the main factor in the development of medicine, full stop. It's going to ask you most likely about a specific part of the course, and that will be either surgery, public health, the treatment of disease, which is what you can see here, or beliefs about the causes of illness. So it's effectively matching up factor with area of the course, and if you put those things together, you can plan for it. And my students will know they've been issued with a table with all sorts of examples. At the top, you've got the 4 areas of the course, surgery, etc., and then down the side you've got your factors, and you can create a lovely table with all of the things in it, and if you revise from it you'll have plenty of things to say. So you're going to need examples that relate to those following factors. The factors that you need to know about are religion, war, government, chance or luck, communication, which means how ideas are communicated, books, internet, etc., science and technology, and the role of the individual. So many individuals in this course, you've got to have that in your mind, but the big ones definitely war, government, science and technology. I mean, really you ought to know something about all of them, because you never know what the factor is going to be. Now, your answer needs to include evidence from across, probably, I say this, it's most likely from across the 4 periods, but check that time period. And really what you've got to do is say, well, how did, for example, this individual influence medicine, and how significant was that? You know, and if you can, did that help or hinder progress? So we were talking about Galen, weren't we, earlier on, and Hippocrates, and so you'd want to say, well, this is what they did, this was how big the impact was, and that impact either helped or hindered progress during this period. Okay, so that is where you are with that question. Remember, it is an essay question. Okay, all the best.